I rise to join Ms Payne in welcoming the tabling of this important report into the inquiry of workplace drug testing. The inquiry found that while a few sectors have mandated regulations in place for workplace drug testing, most industries in Victoria operate in a relative vacuum. WorkSafe guidance on this was last updated 17 years ago, almost a decade before medicinal cannabis was legalised in Victoria. The inquiry heard that the lack of up-to-date regulations resulted in discrimination and dysfunction and terrible outcomes for workers. Happily, this issue is addressed in the committee's first recommendation that drug testing should only occur where employers have a well-founded belief that an employee may be impaired at work, and should only then occur in the context of a comprehensive alcohol and other drug policy and accompanying support framework as agreed between employers and employees. In other words, drug testing should not be imposed randomly at work. When required, it must be done respectfully and with appropriate supports in place. Further recommendations aimed at modernising existing regulations include amending the Health and Safety Act to define key principles around AOD testing, requesting that WorkSafe convene a multidisciplinary working party to develop a compliance code to address matters like rights and obligations of employers and employees, education, model policies and practices, and how to access support, a broad-based public education campaign, and a recommendation that WorkSafe investigate impairment testing technologies for their suitability in workplace settings. Legalise Cannabis Victoria commends the report and urges the government to expeditiously give life to its recommendations. Finally, we express our heartfelt thanks to all of those who contributed to the inquiry and to our wonderful Secretariat who so ably supported all concerned.